How does physician-assisted suicide work legally? Imagine facing a situation where a loved one is suffering from a terminal illness and wants control over how their life ends. The legal process for physician-assisted suicide is designed to respect that choice while ensuring safety and fairness. In certain places, laws allow terminally ill adults who are mentally capable to get medication from a doctor that they can then take themselves to end their suffering. This process is called physician-assisted suicide, also known as aid in dying or medical aid in dying. To qualify, the patient must be at least 18 years old and living in a state or jurisdiction where the law permits it. They need a diagnosis of a terminal illness with a prognosis of 6 months or less, confirmed by 2 different doctors. The patient must be mentally competent, meaning they can make clear decisions about their care and not impaired by mental health issues. They also have to be physically able to swallow pills or take the medication themselves without help. The process begins with the patient making multiple requests for the medication. Usually, they make 2 oral requests at least 48 hours apart and 1 written request on a special form. The written request must be witnessed by at least 2 people who are not related to the patient, not beneficiaries of their estate, and not involved in their health care. These witnesses confirm that the patient is acting voluntarily and not under pressure. The patient can change their mind at any point before taking the medication, which means they can rescind the request if they wish. 2 doctors must confirm the diagnosis and prognosis, and verify that the patient is mentally capable to make this decision. If there is concern about mental health, a psychological evaluation is required before prescribing the medication. Doctors are responsible for informing the patient about all end-of-life options, including palliative and hospice care. They are not required to participate if they choose not to, but they must inform the patient and transfer care if needed. All steps and decisions are carefully documented and reported to ensure the law is followed. The medication prescribed is meant to cause death when taken by the patient. The patient must ingest it on their own, without assistance, which is legally required. This differs from euthanasia, where a doctor directly administers the medication to end life, which is illegal in most parts of the United States. From an ethical point of view, laws around physician-assisted suicide aim to balance respect for a patient's autonomy with the need to protect vulnerable individuals. They emphasize that the patient must be fully informed and capable of making this choice. The process also seeks to prevent abuse by requiring multiple requests, witnesses, and medical confirmation. Overall, these laws are designed to make aid in dying a safe, voluntary option for those facing unbearable suffering with no hope of recovery.